Mitral valve disease is either a problem with the valve being leaky, or as we call it, regurgitant, or stiff, or stenotic. If the valve is either leaky or stiff, it's not working properly and doesn't allow the blood to flow through the heart in the normal fashion. Well, a little bit depends on whether it is a regurgitant and leaky valve or a stiff or stenotic valve. But typically, the symptoms that go with mitral valve disease are shortness of breath, particularly with some exertion, and occasionally palpitations, where their heart feels like it's racing, beating extra times when it shouldn't. And that can even be with exertion or at rest. The patients that are most at risk for mitral valve disease may have had a congenitally malformed valve. Since birth, they had a problem with their valve that gets worse over time. Other patients, such as those with mitral valve prolapse, have a condition where there's redundant or extra tissue to the leaflets of the mitral valve, and that causes extra stress and strain on the valve. And the cords that support the valve over time may rupture, and then that valve is regurgitant or leaky. Also, patients that have had rheumatic fever can end up with a stiff or stenotic valve because those valve leaflets get thick, and the valve therefore can't open very easily. Mitral valve prolapse and the subsequent problem, mitral valve regurgitation, is typically diagnosed by physical exam. Listening to or auscultating the patient's chest will reveal a murmur. That is typically followed up then with an echocardiogram. This ultrasound allows us to see the function of the heart and gives us very good views of the function of the valves, especially the mitral valve. And we can readily detect if there is a leak and the degree with which that valve is leaking. The treatment for mitral valve disease almost always ends up with a surgical procedure. It's a mechanical problem. It's doorways, if you will, in and out of the heart that aren't working appropriately, and therefore it requires a mechanical solution. Medicine typically doesn't really fix that problem. Most mitral valve repairs, if that's the only procedure that the patient needs, can be done in a minimally invasive fashion. And this involves either a small sternotomy, a small thoracotomy, or occasionally can even be repaired robotically with several small incisions between the ribs. The important thing, though, is that you get a complete and effective repair, regardless of the approach. But as it is now, these procedures can be done in about 2 to 3 hours, and then most patients are home in 2 to 3 days after such an operation. So once you're discharged from the hospital, the typical postoperative recovery is about 4 to 6 weeks at home. Within a few weeks, patients are able to get back to driving and certainly their activities of daily living. But it usually takes a couple more weeks even after that before they're ready to return to work. There isn't necessarily a lot of pain. In fact, most patients are taking over-the-counter pain medications once they leave the hospital. But it's just the fact that your heart and your body needs a fair bit of time to recover from this sizable operation.